Welcome to another edition of Lasing is Amazing with Dr. Glenn Van Ness. Today's topic is a laser-assisted extraction of an unrestorable upper premolar. It's an 84-year-old man. You can see it's an upper right first premolar. It was unrestorable. We're using the laser at 2.75 watts with an MZ6 tip of 14 millimeters. The function here is twofold. One is to remove some bone underneath the soft tissue, and second function is to remove some soft tissue to allow us to grip both the buccal, which is a fair amount of tooth structure, and the lingual where there was no tooth structure available. We use the BioLay tip, 14 millimeter tip, in a sewing needle fashion, going up and down at a setting of about 2.75 watts, 75 hertz. And what we're doing is just pushing the bone back a little bit to loosen the tooth, create a little moat. On the lingual, you can see that there isn't a lot of tooth structure to grab a hold of. So we're using the laser here to also remove some soft tissue. And you can see here as we blow away a little bit of the water in the mirror that the laser is being used in a more superficial fashion to remove some soft tissue and then to remove some underlying bone to allow us to grip hold of this. Now once we've completed using the laser, and after a couple minutes, we should take a serrated forceps, this is our serrated tip forceps, and we're now able to grab a hold both of the buccal and the lingual and be able to remove the tooth without any luxation because the teeth were so heavily restored. The fear was that we were going to end up with nothing on the buccal, nothing on the lingual to grab a hold of. It was just going to break. Tooth came out in one piece, as you can see here, and we're able to show you how the root tip forceps were able to grab a hold of the superficial portion of the root. Here we have a view of the socket. You can see a little bit of bone loss or bone removal on the mesial and the palatal, but no burning, no problem there. So I want to thank you again for viewing. I want to thank BioLays for their support, and until next time, keep lasing. It's amazing.